In this presentation, we will be reviewing the basics on how to conduct a vision screening using a chart, as a Friends for Sight Screening volunteer. Using a vision chart is the most common way that vision screenings are conducted. Friends for Sight volunteers use vision charts to conduct vision screenings at schools, health fairs, and other community events. Friends for Sight uses two different charts to conduct vision screenings, the Sloan Vision Chart and the Lee Symbols Chart. Either chart can be used to accurately assess a subject's visual acuity. The best chart for the subject will depend on the individual's familiarity with the English alphabet. Both charts are intended to be used with the subject standing 10 feet away from the chart. Each line of the chart has a corresponding visual acuity fraction to each side of the line. The left-hand side has fractions represented by 10 over a number, and the right-hand side has the equivalent fraction shown as 20 over a number. Our volunteers will be using the 20 over fraction for referencing and recording of results. The closer the bottom number of the fraction is to 20, the sharper the subject's visual acuity. Friends for Sight follows the Utah Department of Health's guidelines for vision screening in schools. Subjects who are 4 or 5 years old are screened at the 20-40 line. All subjects 6 years or older are screened at the 20-32 line. To pass the overall screening, the subject must be able to correctly identify at least 3 of the 5 letters or shapes on the passing line with each eye. To set up a screening lane, tape the vision chart on a wall, or place it on some kind of stand depending on what is available in the space you're using. Try to place the chart at the approximate eye level of the subjects you'll be screening. Use a tape measure to measure 10 feet from the chart. Use a piece of tape on the floor to mark the distance, or tape footprints on the 10 feet mark. As you are screening, the subject should stand so that the arches of their feet are at the 10 feet mark. Make sure the screening lane has a writing surface, appropriate paperwork, a pointer, some occluders to cover one eye at a time, and a symbols card to reference when using the Lee Symbols chart. With the vision chart in place, the 10 feet mark measured, and the proper supplies in place, you're ready to start screening. If you have 2 volunteers at each lane, one should point at the chart while the other stays with the subject. Results are recorded differently, depending on the event. Public schools use student lists or blank sheets that are filled out by the volunteer. Community events use a tally sheet to keep track of the number of individuals screened. Vision screening results are confidential and should not be shared during the event. When screening a subject, ask whether or not they wear glasses. If the subject does have glasses, be sure to mark this on the results sheet even if they are not worn during the screening. Conduct the vision screening with the subject wearing their glasses if possible. To begin the screening, have the subject cover one of their eyes with an occluder. Results are recorded right eye, then left, so have the subject cover their left eye first. Periodically look at the subject being screened to ensure that they are completely covering their eye. You only need to use one set of 5 letters to screen each eye. If you use the right set for one eye, then switch to the left set for the other. If you are using the Lee Symbols chart, screen with one eye going left to right, then the other going right to left. Point at one letter or shape at a time. If the subject passes, have them cover their other eye and repeat the screening process. If the subject can't correctly read at least 3 out of the 5 on the pass line, move up the chart one line at a time. When they can correctly read half of the letters on the line, record that fraction for that eye. When using the Lee Symbols chart, review the symbols with the subject before the screening. If the subject is too shy to verbally identify the symbols, they can play a matching game and point at the symbol they see on the chart to the card in front of them. Large schools may use multiple screening lanes. One lane at the screening will be for rescreening students who failed the initial screening. Ask a Friends for Sight staff member or school nurse for instructions regarding specific screening lanes. After both eyes have been screened and the results have been recorded, the screening for that subject is complete. Subjects who failed their screening will be referred for a full eye exam. At community events, referrals are handed directly to the subject after the screening. At schools, referrals are distributed after the screening by the school staff. Each screening is different depending on the location and population we are screening, but this training will arm you with the basics of chart vision screening. Ask a Friends for Sight staff member for specific instructions at your event. Thank you for volunteering and helping us with our mission to save sight and change lives.